Phase 5 is the recovery phase. The right glenohumeral joint will start in flexion, and the left glenohumeral joint will start in a slight flexion. Both sides will continue going to further flexion movement. The tension is concentric, and the muscles used are the anterior deltoid coracobrachialis and pec major. The scapulothoracic joint will start in elevation, protraction, and upward rotation, and end in the same position, which causes no movement. The tension is isometric, and the muscles used are the levator scapulae, trapezius, rhomboids, pectoralis minor, and serratus anterior. The elbow will begin in flexion and continue into a further flexion, causing a flexion movement. The tension is concentric and will use the bicep brachii, brachialis, and brachioradialis. The wrist will start in flexion and end into more of a flexion. This will cause a flexion movement with a concentric tension. The muscles used are the flexor carpi ulnaris, flexor carpi radialis, and palmaris longus. The fingers on the left hand will start in a slight flexion, while the right fingers will already be in flexion. Both will end in slight flexion. The tension will be concentric. The flexor digitorum superficialis, flexor digitorum profundus, flexor hallucis longus, and flexor hallucis brevis will be the muscles used. The cervical spine will be in extension and end in anatomical position. The movement will be flexion with a concentric tension using the bilateral sternocleidomastoid.